Welcome you all to the Med Diaries. I hope our videos which have been uploaded is very useful to grow up your knowledge. Under the head and neck series, we are going to see about the topic pharynx. Pharynx is not a very difficult subject to be understood. Pharynx can be easily seen in the MCQs, SRQs and spot examinations. It's very rare to be questioned in the essay type of questions. So let's move on to the subject. First of all, as a brief introduction, pharynx is a fibromuscular tube. You can see it very easily. It has an incomplete anterior wall and a very strong posterior wall with 3 constrictor muscles. We all know from the childhood, the pharynx is a common entrance for the respiratory tract and gastrointestinal tract. The pharynx extends from the base of the skull to the esophagus. It's nearly about 12 centimeters, and we have some parts of the pharynx and we need to know about the muscles and the gaps and some clinical points. Let's move on to that. Now let's see about the pharynx. Just don't get panic by these drawings. These are just picture for you all to understand easily than seeing the atlas. I hope you will get easy to understand this pharynx by these pictures. Now let's see. In the pharynx, we are going to see main 4 things about its gross anatomy. One is the pharyngo-basilar fascia, superior constrictor muscle, middle constrictor muscle and inferior constrictor muscle. Along with that, there are 3 minor muscles called stylopharyngeus, salpingopharyngeus and palatopharyngeus. First of all, we are going to see about the pharyngo-basilar fascia. The pharyngo-basilar fascia is the thick and fibrous part in the pharynx. Earlier I said pharynx is fibromuscular tube, so it has a fibrous part and a muscular part. This is the fibrous part, which is pharyngo-basilar fascia, which I have been colored in black color. Here also you can see, and there also. This pharyngo-basilar fascia, almost it's made the 1/4 of the pharynx. If we take this attachment of the pharyngo-basilar fascia, it starts from the pharyngeal tubercle. You might study in your skull that there is a part called pharyngeal tubercle. So the pharyngo-basilar fascia starts from the pharyngeal tubercle. It gets along with the pharyngeal raphe. Here, already I have said, there is no complete anterior wall in the pharynx. Here, the pharyngo-basilar fascia, it goes laterally, convex and forward, but it does not cover the anterior wall because there is no complete anterior wall for the pharynx. The pharyngo-basilar fascia is another thing you have to know. It's the most upper part in the posterior wall. We have 3 parts in the pharynx: nasopharynx, oropharynx and laryngopharynx. So nasopharynx is the upper part. This pharyngo-basilar fascia holds the nasopharynx and it gives complete permanent open for the air breathing. The thickness of the pharyngo-basilar fascia is going to diminish from the level it begins to the level of hard palate under the superior constrictor muscle. So the thickness of the pharyngo-basilar fascia going to be reduced. That's all about you have to know of the pharyngo-basilar fascia. Next we are going to see about the superior constrictor muscles. All 3 constrictor muscles, on its name itself, it says the function, constriction. The footballers is going to travel easily through this constriction. These all 3 muscles are very strong and they are going to make the posterior wall in a very strongest way. First of all, we are going to see the superior constrictor muscle. Superior constrictor muscle is the top muscle. You can see in this picture, and here the blue color muscle is the superior constrictor muscle. So if we see this attachment, it's very easily. You just observe this picture and you can tell the story where it is going to begin and where it is the insertion. Superior constrictor muscle is going to arise from pterygomandibular raphe. You can see here the blue color line, that's the pterygomandibular raphe, and it's going to cover behind it and it's going to end with the pharyngeal raphe. So that's the origin and the insertion. The main thing you have to know, the buccinator is going forward to the superior constrictor muscle. You all know the buccinator muscle in the buccal area, it's going to be forward to the superior constrictor muscle. The next to the superior constrictor muscle is middle constrictor. For your easy understanding, I will explain these layers with these markers. If we say the black color is the pharyngobasilar fascia, then the superior constrictor muscle, then middle constrictor muscle, then inferior constrictor muscle. All are on the one line covering each and other. So the middle constrictor muscle is going to cover the lower fibers of the superior constrictor muscle. Upper fibers are arising from the pharyngeal raphe, and the lower fibers of the superior constrictor are going to be covered by the middle constrictor. If we see the middle constrictor in this picture, you can easily identify there is the greater horn of the hyoid bone. Origin, insertion is going to be the pharyngeal raphe. The main thing you have to know, the middle constrictor fibers are going upwards and downwards. Main thing of these muscles, superior constrictor and middle constrictor, is the famous MCQ you have to know is there is a gap between these two muscles. The gap is this. If you can see, the superior constrictor is here, middle constrictor is here, there is a gap. The MCQ, they ask what are the structures in that gap. You have to know. For easy mnemonic, I have made it. I think you will feel easy to remember that. Stylophague, glossally. Stylophague, two muscles, glossally, two nerves. One is stylopharyngeus. Stylopharyngeus is the muscle, is here, is the green color muscle which is above the middle constrictor in that gap. We let's on to move. The next muscle is styloglossus, which is the muscle beneath the superior constrictor muscle is styloglossus. Then to name the nerves, glossopharyngeal and lingual. Glossopharyngeal nerve is next to the stylopharyngeus, and lingual nerve is inside the superior constrictor muscle, not in the outside, internally it goes. Lingual nerve. So those are the four things we are going to remember in that gap. Stylopharyngeus, styloglossus, glossopharyngeal nerve and lingual nerve. Stylophage, glossally. Then the second thing, we are going to see another gap also. Before that, we'll move on to the inferior constrictor muscle. Inferior constrictor muscle is the big muscle and the last muscle. Inferior constrictor muscle, there are two parts. One is thyropharyngeus and cricopharyngeus. On its name itself, we know that is the origin of those muscles. Thyropharyngeus is going to arise from the thyroid cartilage. Cricopharyngeus is going to arise from the cricoid cartilage. So these two muscles make the inferior constrictor muscle. But there is a small difference in those two muscles. One, thyroid cartilage muscle is having oblique muscle fibers. So it goes like this. Cricoid cartilage muscle fibers having horizontal fibers. So if an oblique fiber goes like this and a horizontal fibers goes like this, you will find a gap in this area. This gap is known as Killian's dehiscence. Here I have mentioned Killian's dehiscence. A main clinical point you should know about that Killian's dehiscence. If anyone having an inappropriate contraction of cricopharyngeus muscle, the mucosa pouch of the pharynx will come out and it will protrude. You have so much of diverticulums which are being protruded. Here also the mucosa pouch is going to be protruded, so it's going to be called pharyngeal diverticulum. It's known as pharyngeal diverticulum. This pharyngeal diverticulum needed surgery. They have to incise the cricoid pharyngeus muscle so the patient will be cured. That's the second gap you should know. There is another third gap with some structures, that is between the middle constrictor muscle and inferior constrictor muscle. I have enlarged this picture and drawn for yourself. I don't have much space, so this is a small picture. I think it's zoomed. So you have the hyoid bone, thyroid cartilage, middle constrictor and inferior constrictor. There is a gap. That gap is filled by thyrohyoid membrane. In that thyrohyoid membrane, you have another small gap which some structures are piercing. What are the structures? Famous MCQ. You are going to know as a mnemonic which I have made, NILSA. You can keep a name for a person, NILSA. One is, from Sri Lankan way if you read, nerve, internal laryngeal, from the Arabic, artery, superior laryngeal. So, two structures are passing through the thyrohyoid membrane. You will study this in the larynx also. That is internal laryngeal nerve and superior laryngeal vessels. Rather than that, the cricopharyngeus muscle continues with the esophagus with the inner circular muscles. All these muscles are innervated by vagus nerve, the 10th cranial nerve. So you can ask me, if these muscles are contracting, the muscles will go down. So what is going to elevate? Yes, your question is correct. We have three elevators. Those three elevators are stylopharyngeus, salpingopharyngeus and palatopharyngeus. Those three muscles are going to elevate the pharyngeal tube. In these three muscles I have shown you here, stylopharyngeus, salpingopharyngeus and palatopharyngeus. In this area you should know about palatopharyngeus. It's also a component of the muscle for the soft palate. When you are eating or swallowing a food bolus, the palatopharyngeus will elevate itself and closes the nasopharynx and prevents the food bolus going into the nasopharynx. It's a prevention, protecting us. And then when you eat, the food bolus goes down, the tongue will be depressed. When the palatopharyngeus is elevating, there will be a beautiful clean gutter, so the food bolus will go easily to a GIT. So we have studied pharyngobasilar fascia, three constrictors, three elevators. All six muscles. There's a small difference in the innervation. You can easily remember this, right? I said all the constrictors are innervated by the 10th cranial nerve. In these elevators, except one muscle, other two also innervated by the 10th cranial nerve. An exception muscle is stylopharyngeus, which is supplied by glossopharyngeal nerve. You can easily identify or remember the glossopharyngeal nerve is near to the stylopharyngeus muscle. Here you can see stylopharyngeus and glossopharyngeal nerve. So the glossopharyngeal nerve is going to innervate the stylopharyngeal, small exception. With this structure, we'll study a little one thing. The pharyngeal plexus, the main innervation of the pharynx. Pharyngeal plexus is the union of vagus, 10th cranial vagus, glossopharyngeal nerve and with some cervical sympathetics. All three components union make the pharyngeal plexus. Pharyngeal plexus is mainly going to be in the posterior wall of the pharynx, this area. As we say precisely, it's posterior mainly to the middle constrictor, the pharyngeal plexus. Those are some important points of the gross anatomy of this pharynx. Next, we'll move on to the main three parts of the pharynx, which are known as nasopharynx, oropharynx and laryngopharynx. Now let's see about the nasopharynx. Nasopharynx is the most upper part of the pharynx. On its name itself we know naso. So it's connected with the nasal part. The nasopharynx, the extension of the nasopharynx, if we see, it's come from the base of the skull to the upper border of the soft palate. Base of the skull to the upper border of the soft palate. The nasopharynx, there are main three features, that is auditory tube, pharyngeal recess and pharyngeal tonsil. Those three things are in the nasopharynx. Those are important you to be remembered because it's an MCQ. The auditory tube, pharyngeal tonsil and pharyngeal recess. Regarding the pharyngeal tonsil, you should know something. What is pharyngeal tonsil? Pharyngeal tonsil is a collection of lymphoid nodules. This pharyngeal tonsil is most prominent only in children, not in adults. When it is enlarged, it takes the name called adenoids. In adults, this pharyngeal tonsil or adenoids won't be there because it is atrophied when we are going under puberty. So the pharyngeal tonsil or the enlarged pharyngeal tonsil taking the name adenoids is most common and prominent in children only. Then the oropharynx. Oropharynx, oro, so it's connected with the oral part. So the oropharynx is next to the mouth and tongue. The oropharynx extension is from the lower surface of the soft palate till to the upper border of the epiglottis. We know there are three tonsils: pharyngeal tonsil, lingual tonsil and palatine tonsil. Already we know the pharyngeal tonsil is in the nasopharynx part. The lingual tonsil and the palatine tonsil both are situated in the oropharynx. Nearly the oropharynx end with the halfway down at the C3. Then the laryngopharynx. Laryngopharynx is connected with the larynx. It extends from the upper border of the epiglottis till to the lower border of the cricoid cartilage at the level of C6. There are some structures in the laryngopharynx that you will study in the larynx. That's all about the total gross anatomy of the pharynx. I hope you all understood this little content of pharynx. Some questions which have come in the past. Question number 1 regarding the nasopharynx. It has opening of the auditory tubes. It's true because already I have said the main three features of the nasopharynx is the auditory tubes, pharyngeal recesses and pharyngeal tonsil. Those three are opening in the nasopharynx. So stem A is true. B, it has pharyngeal recesses. True. C, it is lined by pseudostratified columnar ciliated epithelium. This comes under your histology. With your histological knowledge, you should say it's true because nasopharynx is similar to the respiratory epithelium, which is lined by pseudostratified columnar ciliated epithelium. Rather than this, the oropharynx and laryngopharynx both are lined by stratified squamous epithelium. D, it has palatine tonsil. Already I have said we have three tonsils: pharyngeal, palatine and lingual. Pharyngeal tonsil is situated in the nasopharynx. Palatine tonsil and lingual tonsil is situated in the oropharynx. So D is false. E, adenoids is a common clinical condition in adults. What is adenoids? Adenoids is the enlarged lymphoid nodules in children. The pharyngeal recesses is known as the adenoids when it is enlarged. It is only common in children, not in adults, because in adults it gets atrophied during the puberty. So E is false. 2. True or false? A. Buccinators interdigitate with middle constrictor of pharynx. It's false because superior constrictor muscle fibers only interdigitate with the middle constrictor of the pharynx. Buccinator is just forward to the superior constrictor muscle. That's it. B. Pharyngeal plexus contains both the motor and the sensory nerves. It's true. Already I have said pharyngeal plexus is the main supply for the pharynx, which is precisely situated in the posterior wall above the middle constrictor muscle. This pharyngeal plexus components are vagus, glossopharyngeal and cervical sympathetic. The glossopharyngeal nerve gives the sensory to the pharynx and the vagus gives the motor supply to the pharynx. So B is true. C. Stylopharyngeus muscle is supplied by the glossopharyngeal nerve. Already I have said in the all 6 muscles except the stylopharyngeus, all muscles are supplied by the 10th cranial nerve vagus, but the stylopharyngeus muscle is supplied by the glossopharyngeal nerve. I said you to make it remember because stylopharyngeus muscle is near to the glossopharyngeal nerve. So C is true. 3. Regarding the muscles of the pharynx. A.
The gap between the skull and the superior constrictor is filled by the pharyngobasilar fascia. It's true because pharyngobasilar fascia is the topmost layer of the pharynx between the skull and the superior constrictor. So A is true. B. Styloglossus passes through a gap between superior and the middle constrictor muscles. B is true. In that gap, I said the mnemonic stylophag and glossally, two muscles, two nerves, stylopharyngeus, styloglossus, glossopharyngeal nerve and lingual nerve. So B is true. C. Caliens dehiscens lies between middle and inferior constrictor muscles. It's false because Caliens dehiscens is only between the inferior constrictor muscles components, which are thyropharyngeus and cricopharyngeus, because those muscle between that muscle fibers there is a gap that is called as Caliens dehiscens. So C is false. D. Cricopharyngeus is continuous with the muscularis propria of the esophagus. Yes, it's true because the horizontal fibers of the cricopharyngeus will continue with the inner circular muscles of the esophagus. E. Pharyngeal plexus lies on the posterior surface of the middle constrictor. It's true. Which of the following gives attachment to the pharyngeal musculature? I have attached you the Gray's anatomy muscle and attachments. You can see the superior constrictor muscle has the attachment with the pterygomandibular raphe, little part of mandible and pterygoid gemellus. The middle constrictor muscle is having the attachment with the hyoid bone. Inferior constrictor muscle is having the attachment with the thyroid cartilage and cricoid cartilage. So A, B, C, D, E all are true. Question number 5. Structures passes between middle and inferior constrictor of pharyngeal muscles. If we see the middle and inferior constrictor muscle gap, that gap is filled with the thyrohyoid membrane. Thyrohyoid membrane is pierced by two structures. That mnemonic I said NILSA. Nil, nerve internal laryngeal. From the back if we come, artery superior laryngeal. So internal laryngeal nerve and superior laryngeal vessels. Glossopharyngeal nerve is the component of the gap between the superior and middle constrictor. So it's false. Stylopharyngeus is also the same. Inferior laryngeal vessels, we haven't seen any vessel like that. Superior thyroid artery, no. Then internal laryngeal nerve, it's in that gap, NILSA, so it's true. So the answer is internal laryngeal nerve.
Thanks for watching. If you love the Med Diaries, like the video, share it, subscribe it and stay tuned with the Med Diaries. We hope our upcoming videos too will help you to lead in your educational purpose. Thank you.